Schooling wise, I went to dental school here in Houston, UT Health Science Center School of Dentistry. 4 years of dental school there. After that, went to private practice, did general dentistry for 3 years. Decided I wasn't happy doing general dentistry. I wanted to specialize in just doing root canals. Went back and did my residency at Loma Linda University in Southern California. Was there for 27 months and decided to come back home and be close to family. So I've been back here doing this for almost 13 years now, just doing root canals. Continuing education wise, we have an annual meeting every year for the American Association of Endodontists. We attend that. Plethora of courses offered there locally. Member of the Seattle Study Club of the Woodlands. We meet usually once a month and have a CE course that's provided. Gives us a chance to have an interaction with the specialists and all the general dentists in the area. We can all benefit from each other. So as far as the way our patients benefit from the continuing education and the education in general, I put things into a frame of reference. For instance, to finish dental school, we had to complete 10 root canals. To finish my residency, we had to complete almost 500 root canals. So got a lot of experience under the watchful eyes of all of our instructors as a resident. And since then, since all I do is root canals all day, every day, you learn to kind of streamline the process. You learn little tricks of the trade, things that work and make things easy and more comfortable for the patients. So endodontics literally means within the tooth. So everything that I do treatment-wise revolves around the tissues inside the tooth or removal of the tissues inside the tooth. So we do a couple things to make patients comfortable and to get rid of that fear and anxiety. Probably the biggest fear is fear of the unknown. They've heard the word root canal, they're scared of it, they don't really know what it is or what it's about. The second part of that is making sure that we get adequate anesthesia, making sure they don't feel anything while we're in there working. And most of the time, once we have this conversation, I can explain to them in as much detail as they want. Some patients require a little more detail than others. They'll understand the process, and we do a lot of steps to verify and make sure that we do have adequate anesthesia before we ever start treatment on the tooth. That usually puts their mind at ease and makes them comfortable, and then we're finished. Inevitably, I hear, I can't believe I got so worked up about having a root canal done. Why do I enjoy doing this? That's what puts a smile on my face. That's what keeps me doing this. Looking at a tooth or an x-ray after we're finished, yeah, that's pleasing to me, but it doesn't do anything for the patient. But having a patient express those sentiments to me that, not only do we fix all of their fears and anxieties, we fix their tooth problem, their tooth pain as well. And a lot of times they'll fall asleep in the middle of that. That really is the reassurance that I'm after, to say, yeah, we're doing the right thing and we did a good job.